Okay, hi there, Dan.
Hi there, Kevin.
My name's Kevin, as you might have guessed. I am here today to train you in how to do CPR. So, before we get started, just a few housekeeping things. Firstly, make sure that you keep yourself safe. If you start feeling any pain while doing the CPR demonstration, just let me know and stop. If we do need to evacuate for any reason, you'll hear a siren going off. And for any other reason, the exits are just out that way. We'll just meet out the front, okay?
All right.
So firstly, what is CPR? It's probably a good idea to explain what it is before we have you do it. So CPR is the combination of chest compressions with rescue breathing or ventilation. The purpose of CPR is to provide sufficient perfusion to preserve life until definitive procedures can be performed. Put simply, CPR is the way that you keep a person's blood flowing so that they don't suffer essentially just cell death because they're not getting any air into their body. And that causes quite a few problems, especially for brain cells. So, when to start CPR? So, if you don't have all the fancy equipment around to test, it's a very simple step. If a person is unresponsive and they're not breathing adequately, or they're breathing in a way that's like a gasping, like grunting sort of sound, commence CPR. If you feel like you're confident enough to check their pulse, as we demonstrated in previous sessions, check their radial pulse, then check their carotid pulse. If you can't confidently find that, start CPR. So, if you also have like the pulse monitor and stuff like that, like you might, depending on where you're working, the criteria are if the person is unresponsive, they have pallor or central cyanosis, so their lips start turning blue, they generally just look like deaf warmed up, or their pulse is less than 60 beats per minute in an infant, or less than 40 beats per minute in basically anyone else, so anyone over the age of 1, start CPR. Basically, if in doubt, if the person isn't responding and they're not breathing properly, do CPR. Because there are situations where you're not going to be able to test it properly. So the most important step before this is to keep calm. Second most important step is to follow doctor's ABCD. As we've run through before, I'll just give you the quick rundown. So, it's just an acronym that we use. The D stands for dangers. You're checking for dangers. So if a person's fallen over and they're not responding, there might be a reason why that's happened. Can you think of any reasons why someone might have that happen?
Oh, they fell over and knocked their head. They're a bit disorientated. Maybe they're intoxicated. Maybe they aren't. Maybe they're a bit shy or they're feeling awkward. Could be a whole bunch of reasons. But there's a difference, I suppose, between not responding in a communicative way and not responding to their environment.
Okay, and what would be a danger, more to the point?
If they've tripped over something, if there's glass shards around, if there's exposed like electrical wiring, if there's like a power tool on, or they're in a car crash, is the thing going to blow up?
No.
That type of stuff.
These are all things worth considering. There's other things like gases might have made them. They might have suffocated on some gas, fallen over as a result of that. So you're checking for all those things before you ever touch the person. So especially when you're concerned that there might be something electrical going on, a good idea is generally to touch them with the back of your hand if you can't 100% rule out that there is something. Obviously, if there's no exposed wire, don't touch them at all. Common sense. But the back of your hand, because if there is an electrical current, your hand will do this. And if you're grabbing onto them, it can result in you holding onto them and actually getting electrocuted as well. Okay, so you've checked for dangers. The patient, there's no danger. The next step is to check for responsiveness. So, hi Barry, my name's Kevin. Can you open your eyes for me? You're making, firstly, you talk to them. If you don't know their name, say, hi, are you okay, mate? Something like that. If they open their eyes and start talking to you, they probably don't need CPR. If they're not responding to that, what we generally recommend is to touch the person to see if that wakes them up. Maybe squeeze their delt there, and just generally see traps, not delts, and just see if they open their eyes then. If they do open their eyes then and seem to respond in a reasonably coherent manner, they don't need CPR. It's that simple. The next step is S, so you send for help. As a general rule, if a person's sick enough that you're even considering all of this, call 000. It's that simple. Even if you think that, oh yeah, you can probably treat them pretty well. It's still worth calling 000 because they can give them a proper checkout, make sure that there's nothing else that you can't see going on. So yeah, either you or a person nearby. Ideally there's a few people around, but if you're by yourself, call 000 yourself while starting to check the other things. So the next step is airway. So even if you're doing chest compressions and all these other things, it doesn't really do anything if they don't have any air going into them. So what you would do in this situation is, as we've demonstrated in other sessions, you would move the head, gently tilt the head back and open their mouth a bit and have a look to see if they have anything blocking their mouth. So this can be vomit, this can be teeth, this can be any number of things. If there is anything like that in their mouth, we just tip them into the recovery position and hopefully it'll drain out on its own. In the past, it has been recommended to do things like use your fingers to get it out. That's not really recommended anymore.
What about their fingers?
You can use their fingers, but there is always the concern that you might push something a bit further down their throat. We're not going to run through exactly how to clear that in that situation today, but one of the things would be to do back thrusts and front thrusts to make them expel whatever it is. Okay, so the next step, you're looking for breathing. If the person's breathing normally, they probably also have a pulse, which is why we mainly check for breathing, especially in a pre-hospital setting. But yeah, you're looking for breathing, you're looking for, are they breathing at, let's say, around 8 breaths per minute? So you can count that, as I've shown. Or are they doing very unusual breathing, like grunting, gasping sorts of breaths, where it looks like they're not really getting any air in? If that is the case, and their breathing is abnormal, or they're just not breathing at all, you can then check the pulse. But in this case, we're going to say that that is enough to mean that you start CPR. So that's the C. You start CPR at a rate of 30 compressions, 30 compressions to 2 rescue breaths at about 100 to 120 beats per minute. A lot of people use the song Staying Alive for it. There are quite a few other songs, some of them a bit more appropriate than others to be doing CPR to. Basically just find what suits you. For this, I'll just say Staying Alive. And the D is defibrillation, which we will cover a bit later. Okay, so airway management, we've taught in a previous session, but as I said before, it's moving the head back a little bit, thrusting the chin down a bit so that you can visualize, and then clearing it if you can. So chest compressions, what you're doing for chest compressions is you're putting your hands on their sternum, interlocked, generally a little bit more to the left because that's where most of the heart is, and then you're aiming to press down to about 1/3 of their chest width, or about 2 inches or 6 centimeters, depending on how you think about it.
Does that camera have to capture you?
Yes, so I'm going to turn the camera a little bit so that they can
just put it maybe a bit closer. Or
well, it sees pretty well from there, so
okay. Yep, cool.
so we'll do that just for this.
Yeah.
And when you're doing it, I'll get a bit closer, okay?
Yeah.
So just watch what I'm doing. So we're making sure that the head's nice and in position. And then we start the compression. So generally you count all of them, and then you're looking to do about 5 sets of these. And then you'll attach the defib pads to see whether or not you can shock the rhythm back in. But for this, we're saying just do 30 and 2 for 5 sets, just to see whether or not you've learned how to do it, okay? So we're going 1, 2, 3, 4, 5, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now for the rescue breaths, you generally try to pinch the nose so the air doesn't just blow straight back out. Ideally, you'll have a face mask for it, or you can make a seal with your own mouth if you're comfortable doing that. If you're not comfortable, you can skip this step and just focus on the compressions, but this is the best way to do it. And obviously, if you've had a bag valve mask, like you might in some of your places, obviously use that. But in this situation, we're going to simulate doing the mask. So you're blowing in, 1, and looking to see if the chest rises as you do it. Then 2, looking to see if the chest rises as you do it. If it doesn't rise, that can mean that there's a bit of an obstruction in the throat. Check it. If you can get rid of it, get rid of it. Okay? So then, after that, we go back to the compressions. So we're going to do it at full speed this time. 10, 11, 12, so you keep doing that for 5 circuits, okay? Do you have any questions?
No, I think I'm okay.
Okay. So, a thing to consider for this, you will get tired as you do this. That's why we recommend only doing it for 2 minutes, if you've got a person to swap over with. If they're not that comfortable with it, and you are, make sure that they actually watch what you're doing, so that they can see how they need to do it when it switches to them. But yeah, generally you're looking to do 5 sets every 2 minutes, which means that you're swapping over every 2 minutes. Other considerations are, we do not, once we start CPR, we keep doing it until either the ambulance arrives, they start waking up, they start responding to you in what you would consider an appropriate way, and they're breathing normally, or other situations where you wouldn't start in the first place, such as if they had injuries incompatible with life, which are usually pretty self-evident on their own. So, what I'll have you do for me now is I'll have you demonstrate just 5 sets of 30 over 2 minutes with the rescue breaths. And yeah, then we'll see how that goes. Okay, so do you want to just, yep. Okay, so we've adjusted the angle for this one. So, as you can see, Dan, we've got a little face mask for it. This is a brand new one, so you don't have to worry about not making contact. So, the general principle of using one of these rescue masks, generally you want to use one of these if you can. Obviously, if you don't have one, it's up to you whether or not you make mouth-to-mouth contact. But the idea is, you're putting that over the nose, making a solid seal over the mouth, so that when you breathe into it, you'll see the chest rise, okay?
Yep.
So, you're putting your mouth there, breathing in, it should inflate the chest as you're doing the CPR. So, what I'm going to have you do now is demonstrate CPR as you saw. Do you have any questions before we start?
No, we can start.
Any health considerations, anything like that?
No, I think we can do it.
Okay, in that case, I will set up this camera and adjust it as we need. Actually, I'll just carry it. Okay, so I'll have you start doing the CPR.
Okay.
So, what are we doing?
First things first, I'm going to check for danger.
Perfect.
Is there any fire or like glass and exposed wire or smelling of volatile gas?
You have checked through and there's nothing.
Okay.
You are completely safe.
I'm now going to go up and approach the person. Hello, can you hear me? Can you open your eyes for me? Can't get anything, so I'm going to squeeze his shoulders.
Yep.
Not really getting anything. Hello? Can you hear me? Okay, I'm not really getting anything.
Yeah, you're not
At
getting
this
any
point,
response.
I'm now going to go over to the phone and call for help.
Yep.
So, ... 0. I'm going to say, hello, I'm at 123 Spooner Street. I'm requiring an ambulance. There's a person who's unconscious.
Yeah, beautiful.
Help.
Okay, so you've told them that, they're happy with all the instructions, they've told you that you should start CPR.
Okay, so I'm now going to look to start CPR. First thing that we're going to do is going to check the airway. So I'm just going to have a little look down. Can't see any obvious thing in the way. His tongue's a little bit. I'm going to rotate it back, open up. There's no vomit or anything. Like if there were, maybe I could consider, trying to spoon it out with his fingers. But there's nothing there at the moment.
Also putting him in recovery would also be good for that.
Sure.
But, yeah, so the airway is clear.
Yep. Now I'm going to assess for breathing, so I'm just going to come down and have a look. And there's no movement in the chest.
Okay, so he's not breathing at all.
Nope. So what we're going to do now is I'm just going to quickly also check for his pulses.
Yep.
Probably not a good sign if he's not breathing. Look for radial.
Yep.
And then look for carotid.
Yep.
If I can't find anything, that's an indication that I now need to really begin the CPR.
Absolutely.
So I'm going to get this mask ready.
Yep.
They're good, and then we're going to start. So compressions are done every 30 compressions for 2 breaths.
Yep.
So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Make sure it's sealed.
So you've only got 2 more to go after this.
One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. One, two, three, 4, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 30.
Okay, good job. So you've done the CPR. I'll just sit you down for a second and we'll take you through any questions or anything like that. Okay, so you did really well. One thing that I didn't explain very well, unfortunately, is you could have put the little strap behind his head, which would have made it a bit faster. But yeah, what you did was still good. Again, generally the emphasis is on just making sure that you're definitely making sure that those compressions keep going. You might have noticed that you're a bit tired after that. It's not exactly an easy procedure.
I don't think the he's got a bit of a hole in the chest.
Yeah.
But I don't think the dummy actually compresses as well.
Yeah, I did notice that when I was using it as well.
But yeah,
Did you have any questions? Any points of interest, anything like that?
how long does it normally take to bring someone back?
Often, it won't happen until the ambulance arrives because they have a lot more tools available to them. Also, generally, we'll use a defib at the same time, which is something that we'll be running you through pretty soon.
Okay.
But yeah, generally, CPR, the main goal of it is actually just to keep the blood flowing so that, especially the brain cell death doesn't occur at quite the same rate. Revival rates aren't fantastic outside of hospital, but this at least gives it a chance. If you just leave them on the ground unattended, they're guaranteed, provided that they're not actually breathing. Did you have any insights, anything that you think that I could improve for the next session?
No, I mean, it's just practice, I suppose, isn't it?
Yeah, it really is. And it's good that you've been able to come in. Thank you very much for that. And we'll run you through the defense soon.
Yep.